Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomical structures of the face in a model. We'll identify the muscles. So we have muscles of facial expression. This is the frontal belly of the occipitofrontalis muscle. This is the frontal belly of the occipitofrontalis muscle. We should have procerus here at the root of the nose, not very distinct in this model. Orbicularis oculi muscle, this is orbicularis oculi muscle, and this is the orbital part of the orbicularis oculi muscle. This is the palpebral part of the orbicularis oculi muscle. Then we'll go to the levator labii superioris eloquensi. This is the levator labii superioris eloquensi muscle here. Then this is the levator labii superioris muscle. So if you go there, this is the levator labii superioris eloquensi. This is the levator labii superioris muscle. This is the zygomaticus major muscle, zygomaticus minor muscle. So zygomaticus major, zygomaticus minor muscle. And this muscle, this is the rigorius muscle. This is the rigorius muscle. This is the orbicularis oculi that is around the eye. Here around the mouth we have the orbicularis oris muscle. So these are the muscle fibers of the orbicularis oris muscle. In this model there is no platysma. Platysma is a flat muscle that is attached to the lower border of the mandible. It is a subcutaneous muscle like other muscles of facial expression. It goes downward. Okay, we got that. Now we'll go to the Depressor Anguli Oris muscle. This is the Depressor Anguli Oris muscle. Depressor Anguli Oris muscle. Then Depressor labii inferioris muscle. We have another muscle, Depressor labii inferioris muscle. This is the nasalis muscle. Okay, here this is the mentalis muscle. This is mentalis. We'll get mentalis muscle here. This is the mentalis muscle. Okay, we got mentalis, and very important muscle. This is the buccinator muscle. This is buccinator muscle. Okay, we got buccinator muscle. These all are muscles of facial expression. So they are innervated by the facial nerve. Facial nerve is the nerve for the muscles which are derived from the second pharyngeal arch. So all the muscles, like this muscle, the frontal belly of the occipitofrontalis, we have the procerus muscle at the root of the nose. Okay, we have the orbicularis oculi muscle, we have orbicularis oris muscle, we have the zygomaticus major muscle, zygomaticus minor muscle, we have the muscle, the levator labii superioris eloquensi, levator labii superioris, we have the muscle, the Depressor Anguli Oris muscle, and we have the Depressor labii inferioris muscle. Okay, they are all muscles of facial expression. They are innervated by the facial nerve. Okay, we are looking here. This is a very strong muscle. This muscle is the masseter muscle. This masseter muscle is not a muscle of facial expression. This is a muscle of mastication. We have other muscles of mastication like temporalis, lateral pterygoid, medial pterygoid. This is one of them. These four are the temporalis, lateral pterygoid, medial pterygoid, and the masseter. These four muscles are the muscles of mastication. They are derived from the first pharyngeal arch, and their innervation is from the mandibular nerve. So this muscle is innervated by the mandibular nerve. This is buccinator. This is innervated by the facial nerve, because this is a muscle of facial expression. A very important structure here, this is the parotid duct. Parotid duct is coming out of parotid gland. In this model, parotid gland has been taken out, part of it. So the facial nerve should be inside the parotid gland, and parotid gland should extend up to this level. A part of the parotid gland has been taken out to show the branches of facial nerve. Okay, so this is the parotid gland, this is the parotid duct, and this parotid duct opens into the vestibule of the mouth against the crown of the upper second molar teeth. This is the parotid duct. It does not pierces the masseter, but it pierces the buccal pad of fat, buccopharyngeal fascia. It pierces the buccinator muscle, the mucous membrane, and it opens into the vestibule of the mouth against the upper second molar teeth. Okay, we got that. Now we have some blood vessel here. This is the superficial temporal artery. This is one of the terminal branch of the external carotid artery. This is the accompanying vein, superficial temporal vein here. Okay, we have here the angular vein here, angular artery. They will become the facial vein here, and this is the facial artery. Facial artery is a branch of the external, it is a branch of the external carotid artery. This is the supratrochlear vein here. Supratrochlear vein is here. Okay, this is the external jugular vein. External jugular vein is here, that is passing over the sternocleidomastoid muscle. Okay, so all the muscles of facial expression are innervated by the branches of facial nerve. The muscles of mastication is innervated by the mandibular nerve. And regarding the sensory innervation, we have the supratrochlear nerve, a branch of the ophthalmic nerve. We have the supraorbital nerve. Okay, and they are carrying sensation from this part, including the tip of the nose and upper part of the nose, including the upper eyelid. Okay, sensory innervation. The lower eyelid, upper lip, the sensory innervation is from the maxillary nerve. Lower lip and the mandibular area, including the anterior part of the auricle, the sensory innervation is from the mandibular nerve. Around the auricle, you have some muscle, the auricularis superior, auricularis anterior, auricularis posterior muscle, and these muscles are innervated by the facial nerve. Okay, so we got the structures on the face. So if you like my video, please support my channel, please subscribe me, and have a nice day. Bye now.